Oh, Mike, what's wrong?
My bicep's hurting.
Well, today we are going to show you a very easy self-treatment, how to heal a bicep strain.
You can do this at home, and this method has been scientifically researched for years, so you know it works.
Right, and after we demonstrate how to heal Mike's bicep as well as yours, we're going to talk to you about the doctor who actually developed the system. It's been around for a while, and we're also going to show you how to regain full recovery to get active and full potential out of it right after that with a quick little trick that's very simple. All right, let's get right to the treatment. First thing you're going to do is lie down. Actually, on a bed works quite well. You can go on a carpeted floor if you'd like. You're going to have a pillow. Actually, a throw pillow, a little bit smaller, can be helpful. We'll get into that in a little bit. And you just lie there relaxed. Now, this will be Mike's injured bicep. Let's say he's strained it throwing frisbee golf too hard, you know. You're a pretty good frisbee golf player, right?
Sure.
Yeah. Anyways, so here we have the injured muscle. Now, the first step, and you need to follow this very precisely. We're going to supinate or bring the palm up like that. Now we're going to flex this the elbow all the way. What we're trying to do is get that bicep to a shortened position to relieve all stress and maximize circulation. Okay, now the next thing, because the long head of the bicep actually goes up into the shoulder, we need to flex the shoulder, which is this, as far as you feel comfortable. Now, this arm should be completely relaxed. So at this point, Mike is going to grab his elbow and control the movement of this arm or this part of the arm with the other arm or hand. And at this point, I'm going to say we're going to move it around and noodle. In other words, just move it and monitor how that bicep feels. As we go up to this point and to this point, it should be feeling better, that painful strain. And we're going to move it around until we find the point or the position of maximum relief or comfort. Mike, can you find that?
I'm going to say it's right here because I keep bumping my mic with my other arm.
Okay, if you don't have a mic, you'll have a little more freedom. But once you find that, this is really critical. This is a strain counter strain is the name of this technique, or positional release. And at this point, you need to time it for 90 seconds. And throughout that whole 90 seconds, you're going to do nothing but lie there and relax. Don't have the dog jump on you, your kids jump on you. You're not watching TV. Everything is quiet. You're thinking about relaxed breathing. Everything is relaxed. 90 seconds up to 120 seconds. That's going to allow that muscle to relax, increase blood flow, decrease pain. This works very well. Now, once you get to that 90 to 120 seconds, this is important. We're going to allow that arm to come back down slowly, all relaxed, very quiet. There we go. And then extend the elbow out. And now make sure your arm is not going to fall off the edge of the bed. Have a little bit of space there so you can just relax that arm. Now your job for the next couple hours is not to strain that muscle. In other words, you're not going to do any curls with it. You're not going to do any house chores that's going to work that arm. And right now you can massage that muscle gently for a minute or two. It's going to help increase that circulation, relax that arm. And that's the end of the treatment. It just takes a couple of minutes from the whole thing. Once you do it a couple times, it goes easier. And then you can sit up and continue the rest of the day. Now, if this works very well and you feel a release there, you can do it 2 to 3 times per day. Now, once it starts feeling better after a few days, you can start to use it more. When it feels pain-free and that tender spot where that tear or that strain is starting to feel better, it's time to start to get it moving more. But there's one thing you really need to address, and that is the scar tissue in the muscle as a result of the injury. And now that it has repaired, there's some scar tissue that needs to be broke up to regain full function. Okay, before we go into that, I did mention I want to give the gentleman, the doctor, some credit on who actually invented or started this system.
So this technique was developed by Dr. Lawrence Jones back in the 1950s, and at first it was called strain counter strain, and now it's commonly known as positional release technique.
Right. Now, Dr. Jones actually formed an institute and really formally got the system going in 1988, and it has grown since. It's very popular. All therapists are familiar with it, or at least heard of it if they don't use it already. Now, let's get into the part that talks about how to break up that scar tissue very quickly and easily. It's just not very hard.
So once your bicep is feeling a lot better and you may have that scar tissue built up in there, which is limiting your motion or function in your elbow joint here and bicep, you want to actually start massaging in there. You can do just manually, which is fine. It's kind of like you're kneading bread. You want to pick up the muscle bellies. You may find an area that is more tender, kind of work on that area in this case because that's probably the scar tissue you kind of need to break up. Certainly do this 5-10 minutes, whatever comfortable for you. However, if
my hand's already getting tired after 2 minutes.
If you happen to have a massage gun or you're looking for one, you can certainly use those instead of your hands.
You can borrow a friend's too.
You could. So you can use different models or different strengths. Use whatever one's best for you. I have the C2 here. Brad has a Q2. We right now have the Pro models, so they have this heat and cold head function on them. That's only available on the Pro models, but you just slightly massage that bicep region, go around, find the trigger point. You can kind of dig in there a little bit more and just do this for 5 to 10 minutes.
That's right. These guns are really becoming familiar. I actually have a person that had bicep surgery. She has scar tissue. The therapist was massaging it out, felt better. And she says, "Can I do this by myself?" She's about my age. And I said, "Yeah." I actually lent her mine. She took it home, used it. She said it was great for pain relief, improved the range of motion, decreased her number of visits she needed to go to the therapist to get the similar treatment. Worked very good. And these new heads are incredible. They get cold and they'll stay cold while you use it, and they heat up to 114 degrees while you're using it so you can get that heat. You use whichever you want, heat or cold, whichever you respond better to. So they're great tools. So anyways, usually about 5 minutes on that area will break it up. You can use that for a few days or whatever it takes to get the results you want.
So if you want to check out more videos on this technique, it can actually be used in numerous joints and locations. So this video here you see on screen is going to talk about muscle knots more up in your upper traps, your neck, or even your upper back region.
Right. So do the strain, counter strain on that area. You can do it to yourself quite easily. Go ahead, watch it, and enjoy the day. Stay not free. Get it? Not free.
God, I was very confused by that statement.
Bob and Brad, the two most famous physical therapists on the internet. Bob and Brad, the two most famous physical therapists on the internet. Bob and Brad, the two most famous physical therapists.